Thank you for joining me on the Ask the Expert series of the Only Healthcare podcast. This is specifically designed for you to talk about the topics of the day, critically important news, and to inform you on things that are taking place and how we can help. I'm Michael Navin, the co-host of the Only Healthcare podcast, and today I'm going to talk about the recent signing of the executive orders for President Donald Trump aimed at enhancing drug price transparency in the United States. President Donald Trump has recently signed an executive order aimed at enhancing drug price transparency in the United States. On February 25th, 2025, he issued an order directly to the federal agencies to enforce and expand upon a 2019 mandate that requires hospitals and insurers to disclose actual healthcare costs. The Department of Treasury, Labor, and Health and Human Services have been given 90 days to develop a framework ensuring clear, standardized price information and robust enforcement policies. This initiative seeks to empower patients with accurate pricing details, enabling them to make informed healthcare decisions. Today, we're going to talk about the impact of this specific executive order on PBMs, which are the prescription benefit managers, and carriers, which are the health insurance entities, as well as the manufacturers. These are all significant players in the space. And in the drug transparency and reimbursement ecosystem, we want to make sure we're qualifying and providing information and what this really means for all of these entities. What does price transparency mean? So there's four key things. One is greater scrutiny on rebates and fees. PBMs negotiate drug prices with manufacturers and receive rebates, but these discounts are often not passed directly through to the consumer or the end paying customer, such as the self-funded employer. Increased price transparency could force the PBMs to disclose rebate amounts and how much savings are actually being shared with patients. Secondly, a potential loss of revenue. If transparency rules expose how PBMs profit from spread pricing, which is what they charge insurers more than they are actually reimbursing the pharmacy, they may face pricing reforms or regulatory actions that limit these margins. The third is a shift towards a direct pricing pass-through model. So with the heightened scrutiny over how they continuously do spread pricing with insurers, the employers who are paying for these services are going to demand more pass-through pricing models where PBMs only charge administrative fees instead of making money from spread pricing and rebates. And lastly, the regulatory pressures on formularies. Some of you may or may not know, but a formulary is the mechanism in which they use to prefer certain drugs over others. Transparency in price negotiations could impact this by leading to less preferential placement of drugs on formularies, which is the drugs that are covered by the insurance company. And the PBM may require the patient and the insurer to justify formulary decisions based on net pricing rather than maximizing rebates. So now I'm going to move on to the carriers, which are the health insurance entities, the health insurance companies. So there's four key things here from our perspective. One, more public pressure on drug pricing strategies. The insurers will need to disclose negotiated drug prices and patient cost sharing information, making it harder to justify complex pricing structures that obscure the actual costs. So this is how they charge premiums for the insurance. Tighter oversight of coverage decisions. So if a drug price transparency reveals that insurers aren't passing enough cost savings to the policyholders, the regulators and lawmakers may push for lower out-of-pocket patient costs in this case, which would impact the profitability of the insurance company. Increased competition among insurance companies. So if patients can easily compare the drug pricing across different plans, insurers may need to improve their transparency and pricing strategies to remain competitive. But this gives the patient the ability to shop for their insurance as well. And lastly, there is a potential cost shift to the patient. So if the rebates and discounts that are currently being implemented in the system to offset premiums are eliminated or redirected, there is a risk that insurers may shift costs to higher premium or other fees. Given the overview of the PBM and the carrier, what is the overall impact of those groups? Number one, the PBM business model is at risk. It relies on opaque pricing and rebates, and they may have to adopt a clearer pricing structure. From our perspective at Only Healthcare Podcast, We think this is a great thing for the patients and for manufacturers because now it levels the playing field and gives them direct price negotiation and clear, transparent pricing and what things are going to cost. Secondly, the insurers have to justify their pricing models. By providing better access to pricing information, this leads to really large industry-wide changes in how drugs are being reimbursed. So again, empowering the patient to be able to have the access and make those decisions with their provider on what drug is best for them, given the pricing as well as the clinical value of that product. The last impact on the insurers and the PBMs is that drug pricing reforms can accelerate. So as public awareness of pricing grows, there could be an increased pressure on policymakers to further regulate PBMs and insurance companies. What does it mean for manufacturers? So number one, it's going to create increased pricing pressures. So by requiring the manufacturer to disclose drug prices in certain things like their DTC advertising, this could create more scrutiny from the consumer and regulator. If you've seen any ads currently, they typically talk about pay as low as $0, ask your pharmacist, go to our website. But what's missing from that call to action is what is the actual price of the drug? And if the executive order passes, when drug companies advertise a medicine, they're going to have to disclose the cost of that drug. Second part of that is transparency could lead to price reductions as companies compete more openly. But the good news here for the patient, as well as the manufacturer, is that it just creates a clear pricing model. It doesn't mean they have to be discounting it down to minimal, right? They can still receive the net pricing they're receiving. It just eliminates having to pay a PBM all those rebate dollars and fees to cover that particular drug. And patient gets direct access to that drug. And the public backlash against high drug prices could push the manufacturer to just lower the drug altogether. We've seen some of these models start to happen. So Eli Lilly is one of the leaders in direct programs, and they have their direct programs with some of their GLP-1 products. So we're seeing that happen already. The second part, which we think is the critically and almost most important part, is the impact on negotiating with PBMs and insurers. If you're not aware, drug manufacturers bring drugs to market, and the first thing they do to do that is negotiate the pricing with PBMs and insurers via the form of a rebate. This game has sort of gotten out of control over the last 8 to 10 years, where the rebates are so high in order to cover a drug, it's becoming unaffordable to even bring a drug to market in certain cases. So we believe that if there's less negotiation on rebates and that the drug manufacturer can sell a drug for a price and actually paid that price, not only they win, but the self-funded insurer wins because they're assuring them that they're going to get the direct price from the manufacturer and no rebate games. So transparency will disrupt these negotiations. It'll limit the manufacturer's ability to offer a rebate, but we also think it will open up the opportunity to go direct to the self-funded employers. And then from a strategy perspective, what is this going to mean from manufacturers? Number one, because you have to advertise the pricing for the drug when you're doing DTC, as I said, this could really deter consumers from taking high-cost medicines that they can't afford. And then the companies may have to shift their promoting the affordability programs to alternative pricing models. But from our perspective here, again, it creates the ability for them to reinvent their strategies when it comes to go to market in a good way. So this allows them to consider different approaches. Instead of just calling on the PBMs and the carriers to cover their drug on formulary, they could be talking to the self-funded employers. They could have a mechanism in which they can have those discussions and actually transact with the self-funded employer to make sure that that employer is getting the best cost and the patient is getting access to the medicine. So I'm just going to conclude that we've seen this coming for the last 3 years, and we are uniquely qualified to really help here. This is something we saw a long time ago. And what I want to throw out there is that this is an invitation to have an open dialogue so that we can make price transparency happen with ease and with really strong strategies moving forward. So I'm going to challenge all of you to engage with us and to explore how to address this and what other things that can be done along the way. We also have a sponsor called Peak Meds, Peak Healthcare Technologies, who's a transparency pricing platform for drug prices. It's the only platform that exists that compares multitude of cash programs that exist and members' insurance. So what's nice about this platform with Peak is that it meets all of the transparency needs up front, gives patients something very easy to use, and allows them to save money and be able to compare drug pricing. Again, I'm going to challenge all of you to engage with us and see if we can help you. So thank you for your time this morning. Thank you for listening into this really critically important topic and change in the healthcare continuum. And please keep in mind to always refer to the Only Healthcare podcast. We love what we're doing, and we look forward to working with you in the future.